Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest on the show, just head on over to missionmatters.com and click on Be Our Guest to apply. All right, so today I have Harsh Vatsangam on the line, and he's founder and CEO of Moving Analytics. Harsh, welcome to the show.
Thank you so much, Adam, for the introduction, and excited to have this conversation as well.
All right, so I'm excited to get into today's topic. So really the impact of behavior change on cardiovascular health. We'll also obviously do a nice overview of what you're doing at Moving Analytics. So definitely excited to learn more about that. And just to get us kicked off, we'll start this show with our Mission Matters Minute. So Harsh, we at Mission Matters, we amplify stories for entrepreneurs, executives, and experts. That's our mission. Harsh, what mission matters to you?
So the mission that matters to me is similar to what our company's mission is, which is to empower every individual to live a life free of cardiovascular disease. And as all of us probably know someone or might have experienced a version of cardiovascular disease ourselves. But the interesting thing about cardiovascular disease is a large part of it is preventable if you can change day-to-day behavior, such as eating better or exercising more or taking your meds. But a lot of people find it hard to change their behaviors. And so our mission really is to help them with that change. And by doing so, basically put a stop to the leading cause of death in the world today.
That's awesome. I love bringing mission-based entrepreneurs and executives on the show to really share, why they do what they do. And so great to have you on. And maybe just to get us kicked off and for the overall topic, tell us a little bit more about just the burden of heart disease in general. I don't want to assume everybody knows that background.
Sure. So heart disease is the number one cause of death in the country today. It causes more deaths than several well-known diseases, including all cancers put together, diabetes and so on. It is not only that, but also just because a number of patients have ongoing chronic heart disease, it costs about something like $500 billion every year in direct and indirect healthcare costs to treat someone in the United States with heart disease. The other part about heart disease, though, if there ever was a silver lining, is that it is actually preventable if you can bring about day-to-day changes in your behavior. And I kind of spoke a little bit about that earlier. So those include things like getting you to exercise more, eat better, and so on. But a large number of people don't have the abilities to change those behaviors. And therein lies the problem of heart disease, which is some of it is genetic and some of it has to do with, a little bit of your environmental factors, but a large part of it is behavioral. And that's where a lot of opportunity exists to make our society healthier.
So how does behavior change? And so you said a couple of things, and maybe we spend a little bit more time on that, just on the behavior change as well, because these tips and things that I'll just throw it out there that that you work on every day. Not everybody knows, including myself. So I definitely want some tips too, because I want to know ultimately how this behavior change can impact cardiovascular health overall.
Sure. And let me know if I get into too much of gory details here, but the heart is essentially a muscle, right? It pumps blood through your blood vessels to other parts of your body, and that blood is responsible for providing oxygen to your cells to basically do their job, and to also carry back waste such as carbon dioxide back, and that's breathed out by your lungs. Now, what causes heart disease is essentially issues with that whole process, right? And those issues can be what I would call plumbing issues. So those are places where either your heart's arteries or your blood vessels arteries are blocked, And as a result, it's like a plumbing system where the water can't flow the pipe, and at some point the pipe bursts, and then you have a problem in your health, right? So that's number one. And the other thing that can happen is your heart's also run by almost like an engine run by a spark plug, and your spark plug may not be working, and that's where you have things like atrial fibrillation, and you install a pacemaker over there. What we are dealing with here is the first one, which is the plumbing aspect of care, right? So, and what causes those blockages? It's basically things like high cholesterol that leads to deposits in your blood vessels, and then those fat deposits essentially build up over time and then cause a full-on blockage over there. What causes those fat vessels? It's basically what you eat. When you exercise, your blood moves back and forth a lot faster, and your heart muscle also exercises more, and therefore it's able to pump higher volumes, which means that it's easier for your heart to pump through and break through some of those pieces. When you take your meds, if you're prescribed meds, they basically dilate your blood vessels and make it easier for the blood to flow through. Or if you don't smoke, or essentially it's easier for your lungs to absorb and release oxygen or carbon dioxide as need be. So that's where the behavioral aspect of heart disease comes into play, where it essentially allows you to influence the physiology of your heart and your blood vessels so that they can do their job and basically help sustain your natural life and sustenance over that as well.
Can you tell us a little bit more about cardiac rehab and what that means?
Yeah, sure. So heart disease affects 1 in 3 Americans in some form, but a subsection of people with heart disease are what are called post-acute heart disease patients. And what post-acute means is that essentially after some sort of an acute event, such as a heart attack or a heart surgery, or what's called a stent or a PCI intervention, they are asked to essentially participate in a behavior change program that's clinically based, where they're connected with a doctor and or a nurse who creates a customized program for them that focuses on them changing their behaviors, and then guides them and helps them problem solve or progress them through that program over a period of 12 weeks. So cardiac rehab is essentially that 12-week program that you would do. And the idea is that you almost literally had a life and death event. But guess what? It's not the end of the world. It's actually a great starting point for the rest of your life, where you can get even healthier than what you were before your heart attack. And you could potentially avoid future heart attacks. And what cardiac rehab does is really connects you to the right medical resources so that the medical team that's around you can create a program that's safe yet effective for you and helps you change the behaviors so that and also helps you manage your condition as part of your recovery so that you don't have that second event or repeat event in your life. And that's why it's super critical. Cardiac rehab is actually considered what's called a class 1A recommendation, which means it is the top of the top recommendations for things that you must do after you're discharged from a heart attack or heart surgery. Like if there's one thing you must do, it's cardiac rehab. And it's widely considered one of the best interventions out there because studies show that if you do cardiac rehab, statistically your risk of getting a second heart attack or event is cut in half, and your likelihood of living another 5 years doubles. So, why would you not do this, right? So that's what power of cardiac rehab is as well.
No, well said, and I mean, very clear explanation, by the way. You said you might get into a little bit more. No, that was perfect. I wanna kind of switch gears a little bit here, and I want to go further into your company, Moving Analytics. First off, tell us a little bit more about the concept and why you founded it originally.
Yeah, the Moving Analytics, sort of the origin story is, so prior to starting the company, I did my PhD in computer science at the University of Southern California. I actually did a lot of work in collaboration with the Department of Preventive Medicine and the Keck School of Medicine at USC, where I did a lot of work in basically using computer science to help individuals with chronic diseases improve their health and lifestyle. Right? So one of the things that became very clear to me back then was I didn't want to be necessarily an academic. I wanted to put out products that would be useful in day-to-day life immediately, right? Like, and that is not to say academics is not useful, but but I wanted to put something that had a very, very short time to impact. It was around that time that I met my two other co-founders who were also doing grad school at USC in business and computer science respectively. And when we got together, one of the things we wanted to understand is where is there really a problem in healthcare today? And we didn't want to be these like technologists who are just trying to create great software. We really wanted to solve a problem that existed in healthcare. And we had this chance meeting with the American Heart Association where they first introduced us to this problem of cardiac rehabilitation. And they said this is a number one priority for us as the leading organization in heart care. And it was one of those things where, sometimes you say there's like, love at first sight. Like that was like how we felt when we saw it. Like, because we were like, wow, this is so interesting. And the more we dig deep into it, the more interesting it is. It was just a situation where we felt, hey, here's a life-saving service. And the reason why people don't get access to the service is because you have to visit a facility 3 times a week to get it. And most people don't have the time or the infrastructure or the facilities to be able to go there, right? Like, because many people have to choose between an hourly job and getting their rehab, and they're going to pick the one that pays them the bill, right? Not the one where they pay the bill. So, we just felt that there was this opportunity to reimagine this area, this field, based on the latest and greatest in technology, but also based on science, and prove that we can actually produce the same outcomes. And that's what led us to create MoveIn as a solution, because we just felt that it was just this case where there essentially 90% of people after a heart attack don't get this solution, and it's because of access to care. And we had an opportunity to change that, and the time was now to do it.
Wow, what an amazing story. And I mean, what I love about it is that first off, you're just, the idea here is that you're improving patient outcomes, right? So meaning, you can literally save lives with this and with these analytics, with this data, and with the, the connection with the patients in general, to have their feedback. What kind of response have you heard from this? Like, what's the market been saying?
So it took us a while to get our gears turning, but once we kind of figured out the formula, we are now seeing, so just to give you a comparison, the status quo usually when we go into a hospital is, maybe there are about 2,000 patients per hospital who are eligible for rehab, and only 10 to 20% of them participate. And of those 10 to 20%, only half of them complete their programs, right? So that's the goal.
Wow, half.
Yeah. So like,
that's a big deal. First off, I don't want to glance over that. That's a big deal. Go ahead.
And just think about the impact, not only in terms of health, but also in terms of, lives spent, right, like as part of it. So
absolutely.
And when we start working with hospitals, and at the end of 6 months, what happens is the 10 to 20% number goes up to 70% to 80%.
Whoa.
And the 50% number goes to basically 80% again. So like we almost like 10 times as many or 15 times as many patients participate in our program compared to, before we started. And I think a lot of that is from 2 factors. So one is the convenience of doing rehab on your own time and your own locations. And the second is, I think, the personalization that you have. So it, again, goes back to this question of access.
No, that's great. I mean, those numbers they're staggering, really. That's a huge win. And I mean, when you think about it, when you think about the convenience aspect and all the other things behind the scenes that are making that possible. I mean, the patient outcome thing, just that participation rate alone, that's huge. So how do people typically work with moving analytics? So is it the hospital systems that are signing up directly? Is it the patients directly? Like, give us a feel overall for how people connect with the brand.
Sure. Yeah. So the thing to know about us is that we essentially have a provider group. So it's very like a virtual
Mm-hmm.
clinic, just like you have multiple clinics on site and so on. So it's sort of like visiting a doctor's office, but it's all virtual, like, and it's done at home. You can come as a patient. You may come to us either through your doctor's referral, or oftentimes in the hospital when you're discharged, you have care navigators who refer you to us because they think you're an eligible candidate for our program as well. Now, we work with you to first make sure that your insurance covers it, and at this point we work with over 10 different health plans across the country, and we're adding more to our kitty every month as well. Let's assuming your insurance covers it, or even if it doesn't, we offer you a scholarship program which helps you kind of maintain like a cost-effective option for yourself as well. And then if you qualify, we essentially ship you a kit. The kit consists of an exercise tracker like a Garmin watch, a blood pressure cuff, a weight scale, a booklet, and then we have a tech support person call you and who reaches out to you and then helps you set everything up. We provide you that white glove service to make sure, because we understand not everyone is technology savvy. And once that's set up for you and everything's working great, they connect you to your care manager, who's usually a nurse or exercise physiologist, clinically trained to create a treatment plan for you. And that care manager works with you to really understand your, not just your baseline, but just your own psychology and your emotional makeup and so on, to really understand what drives you as a person and why you are trying to recover from a heart attack, and what emotional or mental issues you're facing as part of the recovery process. They then use that knowledge and along with their own medical expertise to create a treatment plan for you that's 12 weeks long, which consists of you doing a combination of exercises, a med adherence program. They make sure you're on the right doses of medication. If not, they let your doctor know. The education program, a diet program, and so on. The important thing to remember here is that it's not like everyone does all of these things, right? So your care manager works with you to figure out what's the most important for you to do and what you're most willing to do as a first step in your recovery process. And every patient's different, but every patient's unique, and we recognize that. And that is then taken through a 12-week curriculum to progress you, to help you navigate barriers, to you have weekly counseling sessions where you can talk about your just anything you want to talk about, really, as far as the recovery process. Your coach is here to listen to you. And then at the end of 12 weeks, you get to keep all of the items we gave you, and you get to continue your program, and you get to have continued access to your coach via unlimited text messages or secure messages for up to a year post-discharge as you continue your recovery journey with your own initiatives going forward as well. So that's sort of the rough experience, but our endeavor is to make it, if anything, as much of a white glove experience for you as possible, because that's just the kind of experience we want for our patients in the program.
Well, what a great story. I mean, and congrats on the success. I mean, to really meet your mission of, improving those patient outcomes and to have that success rate, taking some of those stats up to 80% for participation. I mean, that's huge. That's going to save lives, and it already is. I mean, that's just an amazing accomplishment. So that being said, Harsh, first off, it's been a pleasure having you on the show. If somebody is listening to this and they want to learn more of Moving Analytics and they want to follow the journey of the company, I mean, what's the best way for them to do that?
So you could definitely go to our website, www.movinganalytics.com. You can reach out to us at hello@movinganalytics.com, or we just reach out to us on Twitter at Moving Analytics, or LinkedIn as well. Moving Analytics is our company name. And you could, if you're interested in sending me an email about what we do, you could just email me at harsh@movinganalytics.com. And if not me, I'll get you the right person in our team who can work with you as well. Those are all great ways to reach out to us as well.
Fantastic, and we'll put that in the show notes. Of course, make sure that the website's there and easy, just so that our audience can just go and click on the post. So all good there. And if this is your first time to the audience tuning in and to Mission Matters, so what we do is we showcase business owners, entrepreneurs, and executives. We find out what their mission is, and we love really learning about new industries, new products, new technologies, and just bringing them to our audience. So excited to have you on here today, Harsh, to talk about, again, what you're doing. And to the audience, don't forget, hit that subscribe button. And Harsh, really appreciate you coming on the show today. It's been a pleasure.
Oh, it was a pleasure. Thank you so much for these great questions, and thank you for the opportunity to be here.